Now, what are you like in a stressful situation? I think fight or flight are two common responses to a frightening or stressful event. Well, last weekend, Dr Viet Tran, emergency physician and director of emergency medicine research at the University of Tasmania, put med students through their paces to work on their reactions in times of great distress. And it's appropriately named Trauma Weekend. Dr Tran joins me now on your afternoon. Dr Tran, I think we should start with what is Trauma Weekend, because it does sound very traumatic.
Yeah, thanks, Lucy. The trauma weekend is designed as a skills workshop for the final year medical students at the Hobart Clinical School, and putting them through their paces with regards to the emergency management of trauma scenarios and some of the life-saving skills that translate quite nicely when they become interns next year and might come across those life threats with patients on the ward. So we go through a range of different skill sets that they might be faced within the trauma scenarios, and they range from a few things, including simple things as learning how to plaster a broken arm, all the way through to some other life threats, such as needing to put a needle into a bone to give life-saving medications, putting holes into chest to try and relieve stress on the lungs, as well as to help drain out blood that might be in there from blood trauma that they might have as a result of a car accident, as well as things like protecting the windpipe, putting splints on broken bones, and doing ultrasounds to diagnose or find where bleeding might be coming from in trauma situations.
Wow, it's quite comprehensive. I imagine that the students throughout their medical degree are learning about these things in some kind of capacity, whether it be through theory or more hands-on practice. But is it particularly important to do this toward the end of a medical degree?
Yeah, absolutely. I think that the medical program down here is set up quite nicely in that you learn a lot about the theory, and it eases you into into practice and real life scenarios. And as they get to their final years, the nice thing about the trauma weekend is it actually puts all these pieces of the puzzle together. So whereas in the early years you might focus on one specific area of the body, this actually brings it all together, and you're managing the whole patient as well as the whole team that has to look after the patient as well. And so I think it's quite a nice and fitting end towards the medical school training in terms of putting it all together so that they're ready to go as junior doctors next year.
And it is done in a classroom kind of space. So what do you use to create the situations that they're working through? Are there mannequins involved? What's used?
Yeah, it depends on the skills that we're trying to test. For example, with regards to the plastering, we actually use some of our facilitators' arms to help just go through the motions with regards to how you actually put the plaster on. In terms of the putting a needle into a bone that we talked about, there's a special drill that we have to use in those situations, and we use we use chicken drumsticks to simulate a real life bone and what it feels like to drill into that bone. We do have simulated equipment, so mannequins in terms of putting holes into chest walls, but we also use real life people to help work out how to put on things like a splint or a pelvic binder as well. And we also use people to have a look at how we use the ultrasound machine at the bedside to have a look at different organs within the abdomen and within the chest as well. We do also have a simulation on the second day, or multiple simulations, where we do use a mannequin and we pretend that they do have that they've been involved in a car crash or a quad bike injury, and they've got life-threatening injuries. And as the medical student team, they have to work through the challenges faced to try and resuscitate these patients in a simulated environment. But we've got lots of we recreate the resus room, the noise, the chaos, and all the distractions and the noise and the machines that go bing, just to create that sense of urgency and that sense of confusion that they'll be presented with in real life
Yeah, and
next
do you
year
ever
if they're
find
involved
that
in it.
they have surprising reactions to these situations?
Yeah, absolutely. It's quite, even though they have been I guess, for a large part, observers within our hospitals as medical students, and participating on a very small level, being able to being put in the hot seat, so to speak, and being in charge of albeit mannequins in this scenario, in these scenarios, really empowers them to think on their feet, to be autonomous, and they really revel in the ability and the chance to use their own clinical synthesis to be able to look after patients or simulated patients, and really almost be able to fly out of the nest with their own wings. Yeah.
Is it a bit of a highlight of the work that you do working with these final year med students and really seeing all the skills that they've developed come alive in the classroom?
Yeah, absolutely, and even better than that, we've got a faculty of 20 teachers, all who come from the hospital to come and help out on the weekend in their own time, and it's quite nice to see that with our Hobart Clinical School students, we've got an 80% retention rate in terms of them coming back as junior doctors the following year. So we're teaching them throughout their medical school training. We're seeing them grow and progress and become their own individual independent doctors. And then we get to see them on the other side, as our colleagues standing next to us and in real life actually resuscitating these trauma patients at the very junior doctors that we trained as medical students the year prior.
Yeah, and knowing exactly how they'll react because you've actually seen it in real time. This is Dr Viet Tran, who is an emergency physician as well as Director of Emergency Medicine at the Emergency Medicine Research, at the University of Tasmania. When's the next trauma weekend coming up?
Yeah, so we hold it on an annual basis. It's quite a action-packed weekend, and it takes us about 3 to 4 months to prepare for it. And so we're looking at June next year to have another round.
Beautiful. And for people on the other side of things, I guess, Dr. Tran, in an emergency situation, what is your advice to the average person on keeping their head clear and nerves down and, repressing some of those emotions that might make them go off into flight mode and run off when somebody needs assistance?
Yeah, absolutely. I mean, it's a very difficult situation. I think that the biggest thing would be to do a first aid course. We know that in life-threatening situations, it's very simple measures that you can be taught in terms of recognizing a patient who's in danger, who may have had a cardiac arrest where their heart stopped, and to be able to know how to start CPR and recognize those signs, how to call for help, and going through a very basic systematic approach, which is what's taught in St. John's first aid programs and other first aid programs, I think is essential to be able to really clear the mind of any chaos. And it's certainly something that we practice, or we teach our medical students and our junior doctors in terms of keeping things very simple. But to have those simple actions in the first place, I think it's important that everyone participates in a first aid program.
Thanks very much for your time.
Thanks, Lucy.
That was Dr. Viet Tran, who is an emergency physician as well as Director of Emergency Medicine Research at the University of Tasmania, just reflecting there on a weekend called Trauma Weekend, which is something that med students would be very familiar with, but I think the general public wouldn't be as familiar with. And it's a weekend of putting final year med students through their paces, seeing how they react to emergency situations, busting out the chicken drumsticks for them to practice on, as well as mannequins. And as Dr. Viet Tran said, some real life people get involved also. You're listening to Lucy Cutting on ABC Radio Hobart and ABC Northern Tasmania.